following the government's acceptance of pay review body's recommendations. Doctors and teachers in England received a 4% pay increase. Despite warning of budget cuts to schools without additional cash to pay costs, education unions have largely praised the decision. However, when a lesser 3.6% increase was proposed for other NHS employees, such as nurses and midwives, health unions responded strongly. An average 5.4% hike for resident physicians, formerly known as junior doctors, was deemed woefully inadequate by the British Medical Association, which also announced that it would vote on potential strike action next week. In 2023 and 2024, resident physicians participated in 11 different strikes, demanding a 35% rise to compensate for 15 years of below-inflation pay award to put a halt to those strikes. They received raises of an average of 22% over the previous 2 years. The BMA contends that this year's wage award fell short of covering the remaining shortfall. The Royal College of Nursing added that the failed pay review body process keeps nursing staff weighted to the bottom and called it grotesque that nurses had been given a smaller boost than doctors. In order to determine if nurses are satisfied with the increase or wish to proceed with industrial action, the union intends to talk with them. A formal strike ballot could be held if they support the latter. On Thursday, a number of announcements verified a 4% headline award for English teachers, dentists, physicians, and prison guards in England and Wales. According to the health department, the additional £750 top-up for resident physicians will raise their average pay by 5.4%. A 3.6% increase for nurses and midwives in the NHS in England under Agenda for Change contracts, a 3.25% increase for federal servants, including those in higher positions, a 4.5% increase for UK military personnel, and a 3.75% increase for senior military personnel. Perceptions of how generous the offers are complicated by the unexpected 3.5% increase in inflation in the year ending in April. The current amount was compared with the 3.25% offer made by the PCS union, which covers civil personnel below the senior ranks. Wes Streeting, the health secretary, explained the nursing salary award as above inflation, despite the RCN's insistence that pricing increases will entirely swallow it up. The 4% offer for teachers was likely to represent small real terms rise, according to the Research Tank Institute for Fiscal Studies, since government economic forecasts were projecting 3.2% inflation for this fiscal year. Issues with funding. The increases follow ministers' approval of recommendations from a number of pay review committees, which are responsible for recommending pay awards for around 45% of public sector employees. According to ministers, the majority of the remaining funds will need to come from current budgets, and the awards exceed the 2.8% that Treasury had previously budgeted for. An extra £615 million has been announced by the Education Department to meet the increases, but stated that improved productivity and smarter spending would be used to help schools pay for a portion of the prizes. The award, according to the National Education Union, which advocates for educators, is not fully funded and may result in cuts in service provision for numerous schools. However, General Secretary Daniel Kibia told the BBC that strike action was very unlikely and that the offer would be broadly acceptable. After consulting with members, the funding issue is the matter at hand. Members will naturally want us to run a strong campaign on that issue because they care a great deal about it, he continued, in order to obtain additional funding for the increases. The health department maintained that it would be able to avoid cutting frontline services. It mentioned fewer temporary employees, reducing duplication and waste, and getting rid of NHS England as ways to save money. Last summer, Labour put a stop to protracted strikes in the public sector by agreeing to suggested pay increases of 4.75% to 6% for the previous year. Despite ministers' claims that the action was necessary to prevent economic harm, the Conservatives accused them of losing control over public sector salaries. We warned Labour that when they gave in to the strikes and agreed to above-inflation pay demands with no strings attached, the unions would just come back for more, said Edward Arger, the Shadow Health Secretary. The government need to get a grip. Say how they'll pay for above inflation, pay rises without taking money from services for patients, and to stand up to the unions by negotiating a fair, affordable deal for taxpayers.